Hello guys, today I'm going to focus on a very small but important topic, that is the regulation and function of ADH, that is antidiuretic hormones like vasopressins. So what is the mechanism and how they works? Okay, so if you see here in this PPT, so you see the blood capillaries, and there is interstitial fluid, then the ductal cell, which is kidneys, ductal cell, and the tubular lumen through where your urine will flow. Okay, so water is one of the important component of the urine, and if you see in the basolateral membrane, okay, so there will be one receptor called V2 receptor where your antidiuretic hormone like vasopressin will bind, and this B2 receptor is a G protein coupled receptor. You can see here there is alpha, beta, and gamma unit. Okay, so whenever you see the ADH will bind to this V2, which is a G protein coupled receptor, and it is a GS type of receptor. GS means G stimulatory, so it will stimulate. So what it will stimulate? So it will stimulate the adenylyl cyclase. Okay, so once the adenylyl cyclase is activated, it will convert this ATP to cyclic AMP. Now this cyclic AMP will again activate the protein kinase A. Once the protein kinase A is activated, so what it will do, it will phosphorylate this water channel, which is known as aquaporin 2. Okay, AQP2 is a short form for aquaporin 2. With this water channel is generally present in the intracellular vesicles, and this pKa will phosphorylate at a specific amino acid site, which is serine 256. Once it gets phosphorylated, these intracellular vesicles will translocate to the apical membrane, which will be facing towards the tubular lumen. Okay, so once it translocates, so through this aquaporin 2 channel, whatever water is flowing through urine, it will come into the ductal cell. Okay, so ductal cell, once it reaches in the ductal cell, from the ductal cell, then again it will move into the interstitial fluid. Okay, this interstitial space, or we can tell fluid, this interstitial space is hyperosmotic in character, means so much the osmotic balance is so much high here. Okay, so through this aquaporin 3 and 4, this water whatever is there in ductal cell will move to the hyperosmotic interstitial space, and from there, since the osmosis is very high, it will passively move into the blood circulation again in the peritubular capillaries. Okay, so this is how this ADH vasopressin will decrease the urine output and increase the reabsorption of the water from the urine. Okay, now if you see physiological point of view, there are many important things what vasopressins or antidiuretic hormones will do. So generally it regulates the body water balance by increasing the water absorption in the kidney collecting duct via V2 receptor activation, as I have told you now just now. Okay, through aquaporin 2 channel insertion. Then it will maintain the blood osmolarity with narrow limits by controlling the water retention or excretion. Okay, and further it will also, interestingly, it will also maintain the blood pressure. How means this ADH can also, this vasopressin can also bind to the B1 receptor present in the blood vessels, which causes vasoconstriction of the blood vessels. So here two things are happening. You can see the passive movement of water will increase the volume of the blood capillaries or the blood vessels, plus it will stimulate the B1 receptor, which causes the vasoconstriction. So both will respond, both together it will cause increase in the blood pressure. If you see the clinical use of this vasopressin, so generally it is used for the treatment of your diabetes insipidus, to reduce the excessive urination, because the patient with diabetes insipidus will have so much of urination, so it will stop the urine formation there. Okay, then it will also have other therapy, like it will have adjunct therapy in cardiac arrest and hemorrhagic shock. Okay, but you know that everything comes with a side effect. So here side effects, the most common side effect of vasopressin is your NSIAD. Okay, not NSID, it is NSIAD. The full form is your nephrogenic syndrome of inappropriate antidiuresis. Okay, so this is caused due to the overstimulation of your V2 receptor. This V2 receptor, overstimulation of your V2 receptor. Okay, so this is all about this is just a small video, and this is all about your vasopressin. So how it works, what is the mechanism, so what is the physiological role, and what is the pathological role.